Good afternoon, Conway County. I'm Dr. Michael Koone, Marlton Medical Clinic. I'm also the Health Department Officer for the Arkansas Department of Health for Conway County. I haven't been on the air in a while because, to be honest with you, I thought COVID was going to disappear and go away. But as you know, it's come back with a vengeance. We now have the Delta COVID variant out there, which is much more contagious. Its viral load is much stronger for people that get it. You get sicker faster, and we think in the long run it's probably going to be more lethal. That means more deadly, just because of the number of people that are getting it. So I'm going to just talk a little bit about COVID, and I know everybody's kind of getting bored and just washed out with too many numbers and statistics. But I have to say just a few things. And then we have a little bit different format today. I'm going to actually interview on camera one of my patients, a friend of mine, that is a COVID survivor. He has a frightening story to share with you. And I'll introduce him here in just a second. But let me tell you about what's going on with COVID right now. Arkansas, unfortunately, is number one in new cases per capita. That means over 100,000 residents. We now lead the nation. And that's not a good place to be, folks. We know that vaccination, no matter what you think of vaccines, we know that vaccines are helpful in many ways at helping prevent disease, prevent hospitalizations, and prevent deaths. The current figures for those numbers are roughly 90% of hospitalizations, 90% of illnesses, hospitalizations, and deaths are in unvaccinated individuals. You don't have to be an accountant or a rocket scientist to figure that out. 90% are in unvaccinated people. A couple other things just from my personal practice. This week, for the first time, and I hate to say this, but for the first time, I now have pediatric cases in my practice. I have a total of 6 children with positive COVID. Their ages range from 2 to 16 years of age. Fortunately, nobody's in the hospital. I think we're going to be able to manage them at home and keep them there. But just remember that this so far has been an illness of the elderly, but it's not turning out that way now. This Delta is hitting younger folks, 30, 40-year-olds, 20-year-olds, these pediatric cases. Another bad thing to say is 3 days ago, Arkansas Children's Hospital had 6 patients COVID in the hospital. 2 of them were on ventilators. 1 of them has since died. So I'm really frightened about this Delta variant, and I hope that my presentation with my special guest will prompt some of you who have been vaccine hesitant and cautious to consider getting vaccinated. So without further ado, let me introduce a friend and patient of mine, Alan Farley.
Hello.
So I'm going to ask Alan some questions. Before we get into the details, though, Alan, is it okay if I ask you questions about your medical history? I don't want to divulge anything confidential, but for HIPAA purposes, is it okay if I ask you questions about your experience with COVID?
Yes, it is.
Okay, good. So a little background first, Alan. How old are you?
I'm 53 years old.
Okay. What is your profession?
I'm a forester with a local timber company.
Okay, good. Prior to COVID, and we'll talk about when you got it and what kind of symptoms and stuff like that, but prior to COVID, what would you say your level of physical fitness was?
I would probably put it at a very, very good, because part of my job requires me to walk a lot in the woods, and I was walking between 2 and 5 miles a day when we would cruise timber or mark boundary lines or whatnot in rough terrain, and that was a daily event. So I think my health was very good. Take vitamins, eat healthy, get plenty of rest, follow all the health guidelines as far as nutrition goes.
Okay, do you smoke, dip, chew, or vape?
Never smoked, never vaped. I used to chew and dip tobacco, and I stopped completely about 9 years ago.
Okay, so it sounds like you were in good health.
Yes.
You lived a healthy lifestyle. You ate well. You got plenty of on-the-job exercise. You were not a smoker and not a vapor. Do you take any medications of any kind?
Well, the only health thing that my doctor's on me quite a bit about is my cholesterol level, and it's takes a minimal amount of a statin, and I think a 5 milligram statin just to help with my cholesterol.
Okay, so only a cholesterol medicine. Now, they can't see you seated, but I can, and I know you. How tall are you, and what do you weigh approximately?
I'm 6'1" and approximately 192 pounds.
Okay, so I'm not going to call you a diabetic. You're not a smoker. You're not obese. You're not over 65. So you really don't have a lot of risk factors for COVID.
No, not at all.
Okay. How did you get COVID? Do you have any idea?
We actually don't. We've followed all the guidelines best we could. You know, there's always a slip up here and there with maybe not washing your hands right after you've pumped gas or something. So we weren't in any big crowds. We weren't doing any of the higher risk associated activities. But yet here we were. Myself, my wife, and our daughter all contracted COVID at the same time from somewhere.
Okay. Let me ask you, we're going to talk about you in more detail, but your wife and daughter are okay? Did they recover?
Yes, it was almost exactly like a Goldilocks in the porridge. Our daughter had the least problems with COVID. My wife had the medium problems with COVID, and I had the severe problems with COVID.
Okay. Tell me about any vaccination plans you might have had that you weren't able to do, or were you vaccinated? If so, yes. If not, why not?
Well, as you know, as my physician, I'd get the flu shot every year. And as a Marine Corps veteran, I've had every vaccination on Earth. Even the bubonic plague, I've had that vaccination in my life. And with these COVID vaccinations, we had determined we were going to take the Johnson & Johnson variety. And we were on our way to make the appointment, and they pulled it off the market for a little bit to double check things. And we said, well, let's set up an appointment to get one of the, maybe the Pfizer or Moderna vaccination series. And about that time is when we started getting sick. So we did have opportunities, and we let them slip by, which that's a pretty good regret right now. And something that almost cost me my life and took me away from my family, and that is a pretty good regret.
Well, let me get into some more details about your COVID then. About when did you get it? Do you know the date?
Yes. Well, we know we started feeling sick as a family on April 20th, and so whatever the incubation period is before that.
Okay. And then tell me, did you get sick enough eventually to seek medical care?
Yes, we stayed home and away from everybody as a family from April 20th to the 25th. And the 25th, I was just really going downhill. And my wife took me to the emergency room in Russellville, which is our closest hospital. And they did all the checks and double checked that it was COVID. and my pulse ox, my oxygen flow was really low. And so they started me on oxygen and started the shots and IVs.
Did they admit you right away?
Yes.
Or did they send you home for a day or two?
Well, they actually had to wait to clean one of the few rooms that was open. The nurse went herself and sanitized the room and cleaned it real quick and admitted me into the emergency room. And later that night, about midnight or 1 o'clock in the morning, the other room became available in ICU. And I was admitted right then. And I stayed in St. Mary's Hospital for 7 days.
And so you went straight into the ICU then?
Absolutely.
Okay.
It was the breathing was the issue, and the weakness in breathing.
What were your worst symptoms?
Probably not being able to breathe on your own. That's it's hard to explain how scary that is and how bad that hurts, and how helpless you feel when you cannot breathe on your own. That's probably the worst part of it.
So they had you on oxygen. Do you remember the highest percent or level they gave you?
I know the nurses came in, and I had a great nurse staff. It was throughout that week, I believe I had 20 different nurses. And I remember one point about 2 o'clock in the morning on the fourth day, when you see two nurses suited up running into the room with all the alarms going off, you know that it's more serious than it was. And I don't know the exact number, it was in the double digits of oxygen. And they had already changed it to high flow oxygen and started into the double digits. And she said, well, when we get to 15, that's probably when the doctor would start a ventilator. And so they brought, the paperwork in and the, DNR to sign, do not resuscitate if I get this bad. We discussed all those options. And it was a very scary time.
I bet that was frightening for you and your wife.
Absolutely, because here my wife was home sick with COVID herself, and very weak, and she had the fatigue as well, but just not as severe as I had. But it was still very difficult on her.
Was St. Mary's allowing visitors at that time?
At that time, it was one in the room, and whoever came in had to be completely suited up, just like the nurses, with all the protective gear.
Yeah.
And if you were had fever and all that, you were not allowed to come in.
So you think you came pretty close to being on the ventilator then?
I believe I was. I believe a few more clicks of oxygen, and that would have been it.
Okay. Well, I'm so glad that you recovered and eventually got sent home on day 7, maybe?
Yes.
Okay.
And one of the things, Dr. Koone, if people are reluctant to get a vaccination just because of the needle stick, because of the pain of a needle stick, just so you'll know, if you do go to the hospital with this COVID, I had 2 IVs in one arm, a backup IV in the other arm. I had blood drawn every few hours around the clock to check the hemoglobin levels and all of that. And I also had a anti-blood clotting shot every 12 hours. And at some point my arms couldn't take that anymore, so I was getting them injected into my stomach, which is quite memorable. Mm-hmm. And also I had a blood draw from an artery on my wrist because they needed to get an exact blood gas count. And that's also quite memorable with pain.
Yeah.
That was a lot more than a needle stick in the arm.
Sure. So let's talk about after you went home. How long have you been home now? When were you discharged from the hospital?
I was discharged, 7 days. I think it was May 7th when I was discharged.
Okay.
And got back home, and I actually have not been able to work in the field.
That was my next question. Have you been back to work, and why not?
Well, no, I have not. To the field work. I've been able to do a few things, on the computer at home, working from home, but as far as working like I was, not at all. The incredible fatigue, it's a lot less than it was. As I told you before we started the interview, on May 8th, using a cane and having some emergency oxygen close by, I was able to walk about 100 feet outside, about halfway up our driveway, before I had to come back and sit down and rest for a few hours. Mm-hmm. And I kept progressing, and Each day got a little bit better and a little bit better. But now, here we're in July, from April 20th, and now we're in July, and the fatigue is still there. The shortness of breath is diminished greatly. I don't have to have any supplemental oxygen, but I still have to be cautious about what I do. Mm-hmm. The heat is very intense, and it really brings on the fatigue, mm-hmm. and the brain fog, and the dizziness and unsteadiness is still there once you get to that fatigue level. And praise the Lord, it is moving further away, mm-hmm. but it is still here.
So you've been impaired for 3 months now, roughly.
Yes.
Yeah. As your doctor, I would love to say I'm sending you back to work tomorrow, but I don't think I can do that. Do you?
No, I believe we would have some well-fed buzzards on some mountain while I'm cruising timber, I'm afraid.
Yeah, I don't think you could get out in the woods for a while yet.
No.
So you've been severely impacted. Now, she's not on camera, but tell me how this affected your wife.
Well, we're very, very fortunate that my wife was able to work from home with her job for the past few months. And even though she was sick herself, and me, of course, being a little sicker, she was able to take care of me at home. I cannot imagine if I was single trying to do this on my own. I could not have been on my own at home.
You might have ended up in a nursing home.
I would have had to have some help somehow, on a full-time basis for probably 2 months at least. Yeah. And with my wife, she was able to help me with everything I needed help with. And when I first started out, it was going to the restroom, standing up, steadying you while you brush your teeth, all that. Mm-hmm. And like I said, thank the Lord, it's diminished to a point to where I can function on my own, but it is still with me. Yeah.
Well, I'm fortunate for you that you had Tracy there. Sounds like she helped pull you through this in many ways.
Absolutely, and I mentioned the incredibly good nursing staff that I had, and I've also failed to mention not just with COVID, but because I was so weak and couldn't get up on my own, and had to lay down or sit in a recliner so much, I developed double pneumonia. And from what I understand, most of the people I spoke with that has been in the hospital with COVID, almost all of them develop pneumonia mm-hmm. because of that reason. Mm-hmm. And their lungs get fluid in it, and now you can't breathe because of that, and you're weak. Mm-hmm. And so it's a double whammy at mm-hmm. the same time. Yeah. And just being that close to being put on a ventilator and knowing the odds of mm-hmm. recovery from that, that was very scary.
Yeah. And your level of impairment, you're still not able to drive yet, are you?
No, my doctor says that's not a good idea right now until I get to another level of recovery.
So your wife drove you down here today?
Absolutely. Yeah. She had to take off work. If I have a doctor's appointment, she has to take off work. If I have to go somewhere else, she has to take off work. So it impairs the whole family, not just that person.
Sure. Do you have a take-home message for our listeners?
Yes. I would say I wrote down my recommendations for everyone, and just realize that this is coming from somebody that was in very good shape and not in any of the danger categories that were originally listed. But with this Delta variant coming on and all the other, the Alpha variant's still here. It didn't go away. The Delta's coming along like gangbusters, and it's affecting younger people. So please keep that in mind. And I'd say you want to listen to real doctors. Don't go online. Don't go on any of the social media platforms and listen to strangers that you have no idea who they are to give you medical advice. Speak with somebody that you know personally that actually has medical degrees and knows what they're talking about. And when you hear that the Chancellor of UAMS say the average age of the COVID patient in their hospital is 40 years old right now, and that there are no beds available in Central Arkansas hospitals, that's not a political statement. That's just what's happening right now, and it's only getting worse. It's only getting worse. If you put your head in the sand, it's not going to work. So my direct recommendations: listen to real doctors. Assume everyone you meet is infected. Don't take anything for granted, because we have no idea how we caught it. We truly don't. And we were being cautious, we thought, as much as possible, but it's a global pandemic. That's just what happens. You'll want to maintain good nutrition, good hydration, and get plenty of rest, just like the doctors tell you to do anyway. Wash your hands correctly all the time. Even when you think you don't need to, go wash your hands. And probably the number one is talk to your personal doctor about which vaccine you should get. Because I would like to keep everyone that's listening to this from going through what I had to go through and still going through at this moment. And it was probably the scariest time of my life. I was had very, very real thoughts that I would not get to see my family again. And because of the hospital regulations, which are wise, I may not have got to see or hug my daughter ever again, if I would have not made it. And I think I was getting very close to that point. But like I said, praise the Lord, it was some very aggressive medicine. I was on remdesivir for 5 days. I hope I said that correctly. And had the antibody plasma from a donor that they had to ship in, which is, if you're worried about taking something that's not fully approved, that's not fully approved either, but it probably helped save my life. And the nurses were great. They would come in and turn me over on my stomach so I could help my lungs breathe a little better, and turn me back, medicines, cleaning up. It was just is a huge team effort. And I wish, like everything, I did not have this opportunity to sit and talk with you about this. I wish I'd never even been in that situation. And the vaccines hedge your bet to probably a 95, 99% capability. So, as you know, as my doctor, I'm scheduled with our next appointment here in a week, I believe, to start my vaccination. My wife's been vaccinated. Our daughter's getting her first shot. She's over 12 this afternoon. As soon as we leave this interview, she's starting her vaccinations. And a lot of prayer. And you do not want this. You do not want this at all.
Yeah. Well, Alan, I'm sorry you had to go through this. I'm glad you're recovering slowly but surely, and Tracy, you're off screen now, but I want to thank you for taking care of Alan. And
yes, absolutely.
I know this has impacted your whole family, and thank you for coming in today. I think it's admirable that you've done this, and I'm so happy you came. I hope maybe you have impacted some folks here in Conway County, and maybe we can get over all this business. So, to summarize, Alan was in good shape, 53-year-old. He's a Marine Corps vet. Come on, how many of you know Marine Corps vets that get sick? Not very many, but non-smoker, no risk factors. Walked out in the woods 2 to 5 miles every day, and almost died from COVID. So please take this seriously. I have some personal experience with COVID. My daughter's father-in-law is now on a ventilator and is probably not going to make it. His kidneys are shutting down, his heart is failing. So I suspect that we'll have a death in my family in a few days. I'm really concerned about school starting next month, and I'll probably be back on air next week if Larry will have me. I'm going to have a Marlton High School teacher as my guest. Many of you know her. I'm not going to mention her by name right now in case she backs out on me, but she's been in Marlton High School for years. She's got children. Many of you want to hear this presentation from a high school teacher. So everybody, please take to heart the message you've heard today, and I'll see you next week. Thank you very much, Larry.